Hello and welcome back to my channel. My name is Danica Kopp and I'm a master's level social worker licensed at the independent level in both Massachusetts and Virginia. Welcome to Therapy Thursday. Today our topic is medications. Medications is a tough one in the psych field. A lot of people are really hesitant to want to use medications, and I completely understand why. Certainly medications have their own side effects. I think that one of the things that I work with clients is that when we have medical conditions that require medications, we don't tend to second guess our body's ability to kind of fight those infections or kind of fight the illnesses. We just kind of accept that, when we have a medical diagnosis that medications could help. So for example, you have a sinus infection. You don't question the doctor about, maybe my sinuses will just kind of fight through it. We'll be okay. You accept the antibiotic, you take it, you feel better. I also use the analogy with clients about a thyroid disorder. If you have a thyroid problem, you have blood work done, it shows that your thyroid's not working properly, and then you take the hormone for that. It's usually Synthroid or a generic form of that, and you feel better. You can't die from not having a great thyroid. Generally speaking, you're sluggish, your metabolism doesn't run as well, you tend to not have your hair and nails grow as well, maybe a hard time losing weight, feeling kind of tired and just kind of ugh. But it's not deadly. And we don't tend to question a doctor when he tells us that we need a thyroid medication. However, when professionals in the psychiatric field recommend a medication evaluation for anxiety or for depression or other mood disorders, a lot of times clients kind of go, ugh, I'm not that bad. And here's the thing, as professionals, we don't tend to recommend medication unless we are really concerned about your level of, kind of struggle in life. So whether it's with your anxiety, your depression, other mood issues, and then there's obviously the more serious, when you have schizophrenia or schizoaffective, when you're having, kind of some psychosis, which can be like delusions or hallucinations. All of these things are very treatable with medication. And with any, medication, we always are looking at the pros and cons. So again, like a thyroid disorder is not going to kill you, but it's not comfortable. And having depression can actually kill you because a side effect of depression is suicide. That's deadly. So we do want to kind of look at, what's the concern behind that? A lot of people also get concerned because generally speaking, it's not just like a 7-day dose, like an antibiotic. When you commit to medications for psychiatric issues, it's usually about a year commitment. And the reason behind that is that antidepressants, anti-anxieties, mood stabilizers, they need some time to really kind of build up in your system and become a therapeutic level of those. We usually, not we, because I don't prescribe, but prescribers start off at a fairly low dose. And the idea is that the most common side effects are headaches and stomach aches. And when you introduce a very low dose, you tend to be able to build up kind of that body's adjustment period, and then you kind of slowly kind of ramp it up and increase it until the therapeutic dose. And generally speaking, clients don't tend to have many side effects. Side effects are always a concern, but there are always side effects that are a concern with any medication. It's not just psychiatric medications. Every medication that we take has a potential side effect. And we have to, again, weigh the pros of the benefits of that medication against the cons of the side effects. And we got to kind of look at and weight those and decide, what's more important. So feeling better and maybe kind of adjusting to, some stomach discomfort when you're starting out, or feeling really depressed and struggling to get out of bed and struggling to participate in life. Being super anxious all the time, constantly worrying, what-ifing, stuck in my thoughts, can't sleep at night because I lay there just stuck thinking constantly. That is a miserable way to live. I myself have generalized anxiety disorder. I do take medication for it. It has made such a difference in my life. The medication for me shuts my brain off. And for me, that is just, oh my gosh, I told the doctor, like, you're gonna pull it out of my cold, dead hands, because it's just so nice to have my brain not be constantly just. I used to speak so quickly because my brain just couldn't keep up, or my mouth couldn't keep up with where my brain was going. So I hear concerns, I understand concerns, but it always kind of is a little bit frustrating for me as a provider when people are like, nope, not doing medication, nope, 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 nope. And my concern as a mental health, a skilled mental health provider is I know pretty quickly whose medication is going to help and who it's not. I've just been doing this for so long. And so, and I don't prescribe, so I have to then refer you to somebody who does. So I have to make my assessment that I think medication would be helpful. I have to then have you find a prescriber that accepts your insurance or is available. I have to have you wait for an appointment. And sometimes that's like an 8-week wait because people are so booked up. And then you have to kind of start the medication and build it up to the level. And that takes usually 6 weeks to 3 months. So if I, in a first or second session, feel like, ooh, this person could really use a Medi-Val, I want to let them know ASAP so that they can start that process of getting seen by a provider who could potentially prescribe. Because again, if that takes 6 to 8 weeks, I don't want to be waiting 6 to 8 weeks and find out that, oops, we're not making much progress. Let me have you now make an appointment, and you're just so frustrated that you're not getting any progress. So that's kind of why, those of us in the field might recommend it fairly quickly, because we know it's such a long process. And I want a second opinion from somebody who prescribes to see, do they agree with what I'm saying? And if they do, then again, it's going to take that 6 weeks to 3 months until you're really feeling a full effect. That's a long time. If we're talking 8 weeks plus 3 months, that's 5 months that we're waiting for you to feel any effect. Then generally what happens is once you are feeling calmer or less depressed, I can really work with you on skills, and you're in a much better place to be able to really absorb those skills, use those skills, practice those skills, get good at those skills. And then, at 9 months, we then look to wean you off of the medication. Because again, we don't want to drastically stop. You could have side effects there too. And so we look to kind of minimize those by doing a slow increase and a slow decrease. So if you figure over a year of commitment to the medication, it's going to take you about 3 months to get up to a good level. Work with me for 6 months on skills and really getting those hammered down, and then another 3 months to kind of wean off of it. That's your year. Does that make sense? So thank you again for joining me. I hope this was helpful in understanding kind of psychiatric medications. ADHD medications, completely different. I'll do a whole nother video about ADHD medications. Don't forget to like, comment, share, and subscribe. Your comments mean so much to me. You're viewing it in the YouTube platform and liking it there helps so much. If you like my content, hit the bell next to your subscribe button on YouTube and you'll be notified when I post new videos. Thank you again for joining me, and please give me some suggestions for future videos. I really need your help because I'm running out of ideas. Take care. Have a good week.